Hello, my name is Kitty Robinson and I am a Veterinary Investigation Officer working in Carmarthen at the Veterinary Investigation Centre. Today I'm going to present an overview of diagnosing sheep scab using skin scrapes. In this presentation I will cover the sampling technique for taking skin scrapes, what constitutes a good sample, and identification of the sheep scab mite, Psoroptes ovis. Firstly, before taking the skin scrapes, it is important to quietly observe the group in order to select which animals to sample. Sheep can remain subclinically infected for a number of weeks before exhibiting any overt clinical signs of scab, and these signs can vary widely. Infected animals may potentially only display very subtle signs initially. You should take skin scrapes from the most obviously affected sheep. This table demonstrates the wide range of clinical signs which may be observed. Initial signs may be non-specific, including depression and separating from the rest of the flock. More obvious signs of pruritus include biting at the fleece, rubbing against objects, nibbling the body, and scratching with the hind feet. Changes in the fleece can include matting and discoloration, progressing to more obvious areas of wool loss. Classic scabbing and crusting of the skin may be observed, and wounds or secondary skin infections can develop. Condition loss can result from a reduced feed intake. An obvious area of wool loss can be seen here in the centre of the back on this sheep, with loose fleece hanging from the lesion. Once you have selected the most pruritic sheep to sample, you will need to locate the lesions to take the skin scrape samples from. Lesions are most likely to be located at or close to the point where the sheep is nibbling or scratching, so check the fleece for any areas which are damp and chewed, or licked clean, or dirty due to scratching with the hind leg. Palpate the surface of the skin to identify any scabs or crusting. Manipulation of the area of the lesion will sometimes cause the sheep to nibble due to a hypersensitivity reflex. Once you have found a suitable lesion to sample, you want to take the skin scrape from the leading edge in order to get your best chance of finding mites. The leading edge is the lowest point down the flanks or the furthest point from the head, due to the movement of lipids on the skin of the sheep. The leading edge is often moist with serous exudate and sometimes has a greenish-yellow tinge. The greatest number of mites are found here, and you may see adult females with the naked eye, being approximately 1 mm in diameter and pearly white in colour. But you shouldn't rely on seeing the mites for making a diagnosis. In this photo, you can see yellow dried exudate around the edges of the area of wool loss. So in this case, you would be wanting to sample from that very edge area. If the lesion has covered the entire animal and no leading edge is apparent, the disease is said to be regressing. Under these circumstances, mites may be found in what are known as cryptic sites. These include the infraorbital fossa, the pinna, the perineum, and the inguinal fossa. In some infested animals, mites can remain dormant in cryptic sites during a latent phase, often during the summer. During this phase, the animal appears to recover, shows no clinical signs, and the wool regrows. However, they still remain carriers of mites and therefore represent a potential source of infection to other sheep. In a few cases, mites will migrate back into the centre of the lesion. This is the atypical form of scab. The lesion is very dry and flaking. An enormous number of mites are located on and under the flakes, and you will often be able to see these with the naked eye. These animals are highly infective to other sheep. Moving on to taking skin scrapes. Firstly, you want to use curved scissors to remove the excess fleece down to skin level. A small amount of this fleece can be placed into a sealed bag or universal container, and fleece with scabs or crusting attached is ideal. Next, expose the leading edge of the lesion and take the skin scraping using a sharp disposable scalpel, holding it at approximately 90 degrees to the skin. Sauroptes ovis mites are surface mites rather than burrowing, so you do not need to take deep skin scrapes and it is not necessary to draw blood. Carefully scrape the scalpel blade onto the inside of a plastic screw-top container to transfer the sample, and any loose scab can be included in the same container. Dispose of the scalpel blade safely and please do not submit it to the lab. Just to note that fleece or wool samples alone are not sufficient for adequate diagnosis, and samples from multiple animals can be pooled. If mites are visible with the naked eye, these can be placed into a separate plain universal container to aid diagnosis. A mounted needle is useful for collecting them from the skin. When submitting samples to our parasitology lab in Carmarthen, a good sample, i.e. one in which you are most likely to identify mites from, should include lots of scab material from the leading edge of the lesion, plus a small amount of wool from very close to the skin. The skin scrape sample should be transferred to a container and not submitted on a slide or a scalpel blade. The sample should be dry with nothing added. Live mites can be submitted in a plain container. On the other hand, a poor sample would include large clumps of wool or fleece with no scab material, no skin scrape material, or the sample is submitted on a scalpel blade, or a sample which is covered in liquid paraffin or similar is submitted. Mites submitted in water will drown, so live mites can't be confirmed if they're submitted in this way. Moving on to the identification of the mite under the microscope. Sauroptes ovis is a non-burrowing mite. It is relatively large, with a length of up to 0.8 millimeters. It has an oval body with long conical mouthparts and 4 long brownish pairs of legs, all extending beyond the body margin. Adult females are significantly larger than adult males, and in adult males, the 4th pair of legs are shorter than the other pairs. The characteristic features used for identification are the 3 segmented pedicles with funnel-shaped suckers on the 1st, 2nd and 4th pairs of legs, and pointed mouth parts. Here you can see the 3 segmented pedicle. This is the gold standard for identification. If this is difficult to identify, the next step would be looking at the mouth parts and then the head and body shape. Here you can see the pointed mouth parts. Within APHA, ectoparasite examination is undertaken at our parasitology lab in Carmarthen. Firstly, samples are examined by direct microscopy to try to identify mites and/or lice. These will be classified as either live or dead. If no mites are seen on direct microscopy, then a potassium hydroxide digest will be carried out, and this may help to detect mites if they are present in small numbers or they are hidden in scab material. This therefore increases the sensitivity of the test. These example results are from a real submission, and they demonstrate the risk of false negatives if only direct microscopy is used. If you look at sample number 1, there were no lice seen and no mites seen under direct microscopy, but Sauroptes mites were identified after potassium hydroxide digest. The results also demonstrate the benefit of sampling more than one animal, as identifying live mites in samples 2 and 3 confirmed that there was an active infection in this flock. Just to note that the potassium hydroxide digest will kill mites. Therefore, it cannot be determined if mites were alive when the sample was taken, if they are only identified after the digest. Dead mites can remain on the skin for some time after an effective injectable treatment, but it is difficult to say exactly how long for, and it could be up to a number of weeks. This will vary depending on the amount of moisture in the fleece and also the fleece length. If dead mites are found but the sheep are still itchy, then you could consider sampling more animals to try to find live mites or sampling again in 2 weeks. Similarly, if no mites or lice are found, then you could consider sampling more animals and/or sampling again in 2 weeks. Alternatively, the ELISA blood test may be used to confirm whether or not scab was the cause of the pruritus. There are other parasitic and non-parasitic differential diagnoses for skin lesions in sheep. The chewing louse Bovicola ovis is the main differential for scab, and concurrent infections with both scab and lice are possible. As you can see here on the left, lice have a very different body shape to the Psoroptes ovis mite. Coreoptes bovis mites, as seen here in the middle, can affect sheep, causing scrotal mange in rams. Sarcoptes scabiei var ovis infestation of sheep is rare in the UK. This mite can be seen here on the right. Typically, these burrowing mites affect the head, face, axilla and groin of the animal and cause intense pruritus, hyperkeratosis and alopecia. Thank you very much for listening. I would like to acknowledge my APHA colleagues for their input into this presentation.